When someone you love is given a tracheostomy, it can be scary, stressful, and overwhelming. Doctors, nurses, and other medical professionals will always do their best to explain what a tracheostomy is, why it is needed, and any other questions you may have. But this video is here to hopefully explain things even further and to solve any confusion that you may still have. First of all, we would like to explain what a tracheostomy is. A tracheostomy is a surgical opening directly into the trachea, which is a person's airway. There are disposable versions made of plastic, which should be replaced every 28 to 30 days because they can retain bacteria. There are also non-disposable versions, which must be sterilized routinely. Tracheostomy size is often based on the flange of the trach, but it is also determined based on age, weight, and height of the patient. The goal of a tracheostomy is to have a tube with sufficient airflow that is not too large for the person. It should fill no more than 2/3 to 3/4 of the tracheal lumen. There are many reasons to why a person may use an artificial airway. It allows the loved one to maintain a patent airway and to control ventilation and oxygenation. It provides access to lungs as well as connects to mechanical ventilation. It can increase options for oral feeding and communication, and it also increases the option to transfer out of the intensive care unit. Benefits of a tracheostomy include a decreased risk of accidental decannulation, in other words, to prevent the inner and outer cannula from slipping out, as well as improved secretion management, increased comfort for your loved one, and decreased physical restriction. Your loved one's larynx is not involved in the procedure.
You may be wondering why your loved one needed to have a tracheostomy. They may have needed tracheostomy for any of the following reasons. 1, to bypass an obstructed upper airway. 2, to clean and remove secretions from the airway. 3, to more easily and usually more safely deliver oxygen to the lungs.
Next, we will discuss important anatomical structures that will assist in your understanding of a tracheostomy.
This is the mouth. The mouth contains our articulators, such as the tongue, teeth, hard and soft palate, lips, and jaw. This is the tongue. The tongue manipulates and controls the food and liquid that enter our mouth. This is the nasal cavity. The nasal cavity is a large air-filled space above and behind the nose in the middle of the face. This is the epiglottis. The epiglottis is a flexible flap at the superior end of the larynx in the throat. The epiglottis protects the body from choking on food or liquid that would normally obstruct the airway. This is the esophagus. The esophagus is the tunnel where food and liquids will transport to the stomach. These are the vocal folds. The vocal folds vibrate in a wave-like pattern which creates voice. This is the trachea. The trachea is the area in which the tracheostomy is inserted and where air flows into the lungs.
Next, we would like to show you how a tracheostomy works because we understand that it can be difficult to imagine and picture how the tracheostomy is working due to not being able to see inside of your loved one's neck. This model provides a clear view of what a tracheostomy looks like from the inside. Please note the tracheostomy surgery would be completed by a doctor and an anesthesiologist. Care of the trach will be maintained by your loved one's respiratory therapist, nurse, or another clinician, such as a speech-language pathologist, but we will also show you what you can do to help. First, you must wash your hands and check to make sure that the patient or your loved one is positioned optimally with their chin pointing towards the ceiling and their neck extended. Next, you will carefully insert the cannula into the stoma. Do not force the tube into the tract. As you can see, at the posterior portion, also known as the end of the cannula, there is a cuff that will be deflated at the time that the cannula is inserted, making sure to avoid any irritation or scratching of the trachea. The purpose of the cuff, when it is inflated, is to prevent air from escaping around the tube, especially during ventilation. The cuff may reduce the risk of aspiration, as food and liquids cannot slip past the cuff and into the airway, but studies show that an inflated cuff will not reduce the risk of aspiration 100% of the time. The cuff must be deflated if a speaking valve is put onto your loved one's trach. This will allow them the ability to exhale, and it also must be deflated if the trach is being removed. As seen in this video, a syringe will be used to deflate the cuff.
Lastly, we would like to explain how you as a caregiver can help and provide counseling on the impact of swallowing. It is important to know that swallowing may or may not be affected with the presence of a tracheotomy tube. Also, dysphagia, which is a disorder of swallowing, may be increased due to the presence of the tube, surgical procedures, or neurological and respiratory impairments. It may also impair smell and taste, and it also is a disturbance in management of saliva. There is a great source for information, which is the Talk Near. It is published by the Pass Near Inc. for tracheotomy and ventilator-dependent patients, their caregivers, and medical professionals in an effort to provide interesting news and stories, resources and clinical tips, information about new educational opportunities and upcoming events, and more. There is also an app that is called the Pass Near Trach Tools app. The Pass Near's new app enables communication at a touch of a button with user-defined voices and easy-to-use navigation. It is useful tracheotomy resources for patients and clinicians. This is a user-friendly app for mobile devices designed to facilitate patient communication, also to provide valuable information regarding tracheotomy and foster patient participation in their care. Now I'm going to talk about how to clean the Passmere valve. 1. You should swish valve daily in soapy warm water. Also, it is important that it's not hot water. 2. Rinse valve in warm running water. 3. Allow valve to air dry before placing in storage container. Do not apply heat to dry valve. 4. Do not use hot water, peroxide, bleach, vinegar, alcohol, brushes, or cotton swabs to clean valve. Lastly, I'm going to go through if insurance pays for the Passmere valve. The valves are Medicare and Medicaid reimbursable using the prosthetic billing code L8501. The amount of reimbursement for Medicare varies depending on the region. The amount of reimbursement for Medicaid varies from state to state. Most private insurance companies generally follow similar reimbursement guidelines. The valves are also reimbursable by California Children's Services using the code 7549.